Meal planning is an important step in eating healthy. To start the meal planning process, your diabetes educator will have you keep a food diary to record what you eat, how much, and what time of day you eat it for 3 days. The resource guide to this video has a page for starting your food diary. After you bring in your food diary, your registered dietitian or diabetes educator will work with you to create a healthy meal plan based on your weight, physical activity, type of diabetes, diabetes medications, personal goals, and food preferences. As you follow your meal plan, you'll need to test your blood glucose regularly to monitor how your food is affecting your blood glucose levels. We discuss this in more detail in our monitoring chapter. This will help you adjust your diet to make sure you're eating the right foods in the right amounts. Some people like to use pre-portioned meals in their meal plan to provide the meals in the correct portions and to best suit their health goals. However, when planning and preparing your own meals, it's important to use measuring cups and spoons, and if advised, a food scale, to make sure you have the right portion control. The plate method is also an effective way to practice portion control. Using a 9-inch plate, fill half of the plate with approximately 1 cup of non-starchy vegetables. Fill a quarter of the plate with high-protein foods, and fill a quarter of the plate with starchy foods. Add a small serving of fruit and a serving of dairy, and you have a well-proportioned meal.
It's possible to enjoy eating out and still eat healthy. You can find nutritional information for fast food restaurants and many other restaurant chains online or posted at the restaurant. Wherever you are, you can make more healthy choices by avoiding fried foods, creamy dressings, sauces, and soups, as well as foods that are high in sugar or animal fat. The portions at restaurants are often larger than the portions you'll be measuring at home. Sharing a meal or requesting a to-go box when your food arrives are 2 ways to reduce your portion size. Healthy beverages are also an important part of your meal plan. One good tip when it comes to juices, it's better to eat the fruit rather than drink the juice. Fruit juice has high sugar content, but if you eat the whole fruit, you get fiber too. You'll also get closer to the recommended daily amount of at least 5 to 10 servings of fruits and vegetables. If you drink soda, it's a good idea to substitute diet beverages to reduce sugar, carbohydrate, and calorie content. There are other healthy, low-calorie and calorie-free beverages on the market as well. Sparkling water, also known as seltzer water, is also a good option as it is calorie-free. Enjoy it with a bit of lime or lemon to add flavor. If you drink alcoholic beverages, be aware that 1 average alcoholic drink, 12 ounces of beer, 5 ounces of dry wine, or 1.5 ounces of distilled spirits, contains about 100 calories. Wine is not usually high in carbohydrates unless it is a very sweet wine. If you're drinking alcohol, make sure you eat something too, because alcohol lowers your blood glucose level. Eating healthy is a very important part of your diabetes management. It can be a challenge to change your eating habits, but remember, you aren't in this alone.
With the support of your diabetes educator or dietitian, you'll be able to make the best choices for your health without sacrificing taste or the pleasure of sharing a great meal. Having the advantage of a structured diabetic meal plan of prepared healthy foods will teach you about portion control and take the guesswork and frustration out of planning your diet and learning to eat healthy meals. Remember, losing even 5% of your body weight has been shown to improve health.
What do you think of when you think of being active? High-impact aerobics, weightlifting, or intense cardio sports like marathon running?
While these can be great ways to keep in shape, being active does not require you to become an athlete. It just means engaging in some form of regular movement to help support your health. While losing weight is often one positive result of being active, there may be other benefits too, like lowering cholesterol, improving blood pressure, lowering stress, and increasing your energy level. If you have diabetes, physical activity can also lower your blood glucose levels and help keep your condition under control. That's because activity increases your body's sensitivity to insulin, allowing your insulin to work more effectively. Also, studies have shown that people who increase their activity level often have less need for medication. Before you create an activity plan for yourself, make sure you talk with your doctor or diabetes educator to find out what type of activity is safe and appropriate for your given weight and any other physical challenges you may have. Here's some more good news about being active. It doesn't have to require a huge time commitment or lifestyle change, and it can be really fun. There are plenty of ways to make movement a part of your daily life, like taking a walk after dinner. However, these changes will only work if you stick to them, so it's important to choose movement that you enjoy and that fits with the rest of your life. It might be walking, dancing, yoga, or even yard work and gardening. Now, before you start your new plan, keep a log of your normal daily activity for 3 days. This record will give you a sense of how much you move on a daily basis and what changes you can make to become more active. No matter what your preferred forms of movement are, it's a good idea to include both cardio and resistance training in your routine.
Cardio activity is movement that raises your heart rate, while resistance training helps you build muscle and strength. Great forms of cardio include walking, dancing, swimming, cycling, and even hula hooping. Resistance training doesn't have to mean lifting weights at a gym. It can be an activity like yoga, where your own weight provides the resistance, or keeping a couple of small weights next to your desk that you lift a few times a day. Once you've chosen the type of movement you most enjoy, you'll want to talk with your doctor or diabetes educator to determine the frequency, intensity, and duration of activity that's appropriate for you. In the meantime, here are a few general rules of thumb. Ideally, you should work up to doing some form of activity 5 or more days a week. The American Diabetes Association, or ADA, recommends 150 minutes of activity a week and suggests that type 2 patients do resistance training 3 times a week. Be realistic about the length of time you can do an activity. Start with 5 or 10 minutes and work up to 30 minutes or more with medical approval. Find the easiest way to fit activity into your schedule. 3 10-minute sessions throughout the day are as good as a single 30-minute session and can be much more convenient. Because physical activity affects your blood glucose levels, it's important to monitor your blood glucose both before and after you exercise. If you're doing a strenuous activity like running, aerobics, or playing a sport, you may also need to stop partway through your activity and check your blood glucose. The ADA recommends eating something if your blood glucose levels fall below 100. Ask your healthcare provider or diabetes educator when to check for ketones. If you have ketones, do not exercise. If your blood glucose is low before you start an activity session, don't begin your activity until you've had a snack and made sure that your blood glucose levels are back to normal. You may also need to work with your doctor or diabetes educator to adjust your medication before you start your activity plan. And finally, if you ever start to feel funny while you're exercising, always stop and check your blood glucose. Remember, you don't have to be an athlete to enjoy the many positive effects of regular physical activity.
If you have diabetes, activity is a key part of maintaining your health. So find something you'll enjoy doing and have fun.
By going to our website and filling out a short survey about this video, you can help ensure the Living with Diabetes educational program continues to be distributed to other people with diabetes all over the country. On their behalf, we thank you for your support.
Managing your diabetes includes monitoring your blood glucose, blood pressure, and cholesterol.
Right, and we'll talk about blood pressure and cholesterol in the Reducing Risks chapter. But this chapter is about blood glucose monitoring, which is usually done using a blood glucose meter. Knowing your blood glucose numbers is an important part of knowing the status of your diabetes. Regular monitoring also helps you see patterns in your blood glucose levels. With this knowledge, you may be able to prevent complications by adjusting your lifestyle accordingly. Blood glucose is measured in milligrams over deciliters, which is written as mg over dl. If you're a non-pregnant adult with diabetes, according to the ADA, your recommended blood glucose range should generally be 70 to 130 before a meal and less than 180 2 hours after the first bite of a meal. However, blood glucose varies a lot from person to person, so you'll want to consult with your diabetes educator or doctor to determine what target levels are right for you. Monitoring your blood glucose regularly will give you information to help prevent both hypoglycemia and hyperglycemia. Hypoglycemia occurs when your blood glucose is lower than normal, usually less than 70 milligrams. This condition is also known as an insulin reaction in people who take insulin, hypoglycemic reaction, or in extreme cases, insulin shock. Symptoms of hypoglycemia include excessive hunger, shakiness, perspiration, dizziness, lightheadedness, pale skin color, and confusion. If hypoglycemia is left untreated, it can lead to unconsciousness and even death. Hyperglycemia occurs when your blood glucose is higher than normal. Symptoms of hyperglycemia can include excessive thirst and urination. Exactly when you should check your blood glucose and how often will vary depending on